right, LML, did you wake up this morning with a patch of thinning hair? You may have a scalp disorder. It's time to talk beauty with Stacy Vason.
Today we learn what it causes and how to treat scalp disorders. Welcome, Stacy and Dr. Kaplan. Thank you so much for joining us today.
Thank you. It's good to be here.
What we're going to start with, I appreciate you coming to share with us.
Thank you.
But what I want to talk about are the medications that can possibly cause hair loss or scalp disorders. What are some of the medications, for example, high blood pressure? Or
High blood pressure medicine is probably the most common. You have
Wow.
thiazide diuretics that a lot of people are on. You have beta blockers, ACE inhibitors. All these types of drugs can cause hair loss. Seizure medicine can cause hair loss. Antidepressant medicine can cause hair loss.
But even if they are on those medications, they will still come and see you, and you are able to treat and kind of counteract
We
the
can do
side
some
effects.
things to counteract it. We can instruct them how to handle their hair, what not to use too many harsh chemicals.
And tell us a little bit about when you're talking about some of these medications. I'm not sure. Do they come with a side effect like, hey, you could lose your hair? Or when do people need to start paying attention?
Well, it doesn't happen to everybody, but there are a lot of people on antidepressants. There are a lot of people on warfarin or Coumadin for anti-clotting reasons. And it doesn't happen to everybody, but it can. And when it does, it can be significant. Sometimes in the example of a high blood pressure medicine, you could change the blood pressure medicine. You can go to a non-thiazide diuretic that will work just as well.
But they will notice anything that's abnormal for their hair. Like if you shed normally, a patient knows.
Lose 100 hairs a day.
Yeah. But if it's abnormal, then you know, okay, what has changed with my lifestyle that has caused my hair to start to shed? And my client had a question about a medication that she's on, and what I'm seeing is she's balding around the front.
Okay, well, obviously that's when you know that there's some sort of medical issue.
That medication has to do with blood clotting.
Right.
So,
yeah, warfarin I think the patient we discussed had thrombocytopenia.
Right.
Okay.
And they were on a drug called hydroxyurea. And that's like a cancer drug, it's like a drug like methotrexate, and that can cause immediate hair loss within 2 to 4 weeks. You can get something called an anagen effluvium, where you can lose significant hair rapidly.
is that what alopecia is?
That's one type of alopecia. There's a more common type of telogen alopecia, which you can get over time, like after you can get a telogen effluvium after you have a baby 3 to 6 months later. A stressful event, an accident, anything stressful, and that could happen 3 to 6 months later.
Let's talk about childbirth, because I always warn my clients, there's an 85% chance you will lose hair.
You will lose some.
Don't panic. It will come back after childbirth.
Absolutely.
What are some of the early signs of alopecia?
Well, there's several types of alopecia, and certain types of alopecia. A common one is alopecia areata. We almost get an allergic reaction to your own hair, and you get non-scarring hair loss. It actually can affect all the hair of the body, but we can use injections to fix that, and you got to also make sure it's not associated with thyroid disease, diabetes, things like that.
We've talked a lot about hair loss, but are there other scalp symptoms, other things that would happen to your scalp that would maybe need medical attention?
Things like psoriasis, seborrhea, lupus, dermatitis, fungal infections, all that can cause hair loss. All can be treated.
And speaking about those dermatitis, psoriasis, there is so much talk about MONISTAT 7 on the hair and scalp. And those of you who don't know what MONISTAT 7 is, it's a vaginal yeast infection cream. And everyone's talking about it, so I thought I would have
You can use that
on your scalp. Tell them why you can use this on your scalp, not only as an antifungal, it will actually progress your hair growth. Your hair growth.
Well, there's a lot of there is some theory behind this, because
it hasn't been scientifically proven, but it's theory, and I'm doing my own scientific testing myself.
Well, one of the causes of hair loss that we talked about is seborrheic dermatitis, and that's caused by a yeast-like organism called Pityrosporum ovale. And in order to treat that, you need a drug like MONISTAT, but there are others out there. There's Lotrimin, there's Nizoral, there's ketoconazole, and if you can eliminate the yeast-like infection, you will eliminate the cause of hair loss. So there is a little bit of basis to that.
How can, and again, we're going to have all of this information. Sorry, we're out of time for today. Thank you so much for coming on the show.
His information should be on the screen.
For more information, head to our website at localmemphis.com. Go there.